When I came to look at this, I thought, how's the best way I can try and touch on many of these topics? And I thought maybe a physiological view would be quite useful, maybe starting with birth. And we had earlier in this week a debate around maternity services. And the point is this, that there is an explicit risk in pregnancy and birth, but we should do all we can to mitigate those risks. And we know from the last 10 years the maternity mortality gap has reduced by 5 times, but it's to 2 times, but still much more can be done. And I'm pleased where we heard that the government was working through getting the Ockenden recommendations in place. But that leads us on to talking about postpartum depression, breastfeeding, supporting recovery post C-section delivery or episiotomies. We heard about infertility and miscarriage, and not even mentioning looking after a newborn. These are really tough things to be able to go through. For young girls, they have to deal with body image, a personal hobby horse of mine, and we also heard about eating disorders. Now, we have seen in 2023 an investment of £4 million of new research, but there's still much more to do. And of course, that leads us on to cosmetic surgery and when we need to regulate there. There's menarche and managing periods, not only from the contraceptive angle, but what to do when it's too heavy, too painful, irregular, or not at all. All of these things require time, dedication, and compassion to work through to find out what works for that individual, what can be done to support, inform, and empower that woman. If we turn to the medical problems, we heard about incontinence eloquently, but also polycystic ovary disease and endometriosis. Really common problems, hard to diagnose and even harder to treat. But I hope with the rollout of the community diagnostic centres, 161 in total, and the new government committing to carry this on, should make a giant leap forward in allowing women to get the diagnosis that they need. There's, of course, screening. One which hasn't been mentioned is cervical screening. We've talked about breast screening. Screening is so important, I urge every woman to consider it. But what about the successful rollout of the HPV vaccine over a decade ago to dramatically reduce cervical cancer, and now even offering it in 2019 to boys to be able to help reduce that further? Support for both lobular and ductal breast cancer. But one hasn't really been mentioned is ovarian cancer and how difficult that is to pick up and often far too late. Working through life, we have the menopause and the impact it can have on women. Confusion, depression, anxiety, sexual dysfunction, still not being well understood. Now, the last government, along with many from this House who we've heard, campaigned for better understanding to create a supportive environment. And this is still developing, and long may it do so. Choice is hard too. Non-HRT or HRT. There are pros and cons. And of course, we had the difficulties with shortages during the pandemic. But linked to the menopause and not mentioned is the risk in old age of osteoporosis and fractures. Critical. We know that women are more effective significantly than men. And of course, it's much harder to deal with a broken hip or a broken wrist. So I could go on much further. But this is why under the last government, women's health was rightly a priority for the previous government, which had almost 100,000 responses to its call for evidence to deal with the gender health gap. The last government published the country's first women's health strategy in 2022 and expanded specialist women health hubs across England to improve access and quality of care for services such as menstrual problems, contraception, pelvic pain and menopause. It improved access to hormone replacement therapy, addressed barriers to health services faced by women who have suffered trauma of things like domestic abuse. But further still, the government appointed Dame Leslie Regan as the first Women's Health Ambassador to step up efforts to improve women's health, and Helen Tomlinson as a cross-government menopause ambassador to find out the experiences of women employed in different sectors. So turning to addressing the issues here and now, I have some questions for the Minister and some context. The Royal College of Obstetricians and Gynaecologists wrote to me on the 29th of January, just before the announcement by the Labour government, saying the following: "We express our deep concern about the speculation of the government's decision to remove the target for all ICBs to set up and run a women's health hub in the planning guidance." It went on to say, I quote, "Removing the target may lead to women's health hubs being closed down and a worrying rollback on the progress made in improving women's health services for your constituents. It's self-defeating for the UK government to close women's health hubs when they are a clear success story for reducing waiting lists and moving care close to home, and they should instead be ring-fence funding and expanded. Now, I know the Minister cares deeply about improving women's health, but it's hard not to see this as a potential rollback. So question number one, what commitment can the government give in light of dropping these targets that women's health remains a priority? Question two, to help demonstrate this commitment, would the government consider the call by the Royal Obstetricians and Gynaecologists for sustained investment in expanding women's health hubs? And would, considering what we've heard today from the benches from the men from Walthamstow and Luton North, would they make a request in the spring statement and spending review to see that this would be the case? If not, why not? Now, I've spoken in the past in this chamber about looking at previous work. So my third question is, how many times have the government met with the Women's Health Ambassador since the general election? And can she set out how this role would work alongside the government's new menopause ambassador? I hope in asking these kind of questions, it will kickstart the system into looking how we can improve women's health. In the short time I have left, it would be remiss of me not to pick up on some of the key issues present at the moment, namely osteoporosis, menopause, workforce and waiting lists. Now, there's been some concern about the Labour government's commitment to its own promise of universal fracture liaison services by 2030. The Royal Osteoporosis Society have said, we all want to believe that ministers will honour their promise, but people with osteoporosis tell us their faith is waning. It doesn't need to be like this. We appeal to Wes Streeting to restore trust and confidence in their specific measurable pledge that he campaigned on and for which many people voted. So question 4, I'm really sorry, I'm really tight on time. Question 4, could the Minister kindly clarify and confirm and commit to the promise? And if not, why not? When it comes to menopause, the Women's Strategy was announced in 2022, and the then Shadow Health Secretary and now current Health Secretary asked, and I quote, I challenge the Secretary of State to go further than the proposal he outlined in training incoming medical students and incoming doctors. What plans did the government have for clinicians who are already practicing? We need to upskill the existing workforce, not just the incoming workforce. However, let us be clear, informing clinicians is no good if we do not also improve access to hormone replacement therapy. So where is the action in the strategy to end the postcode lottery for treatment? End quote. As we're now 8 months into the Labour government, question number 5 is, could I ask when this strategy document he talked about will be produced and presented to the House? Has he made an assessment and taken since July 2024 about HRT medication access and where it is in its locality? Turning to workforce, we know the demand for women's services is outstripping the supply of generalists and specialist support. The Royal College of Obstetricians and Gynaecologists has highlighted that there are ongoing problems with maternity workforce staffing and have agreed that the NHS long-term workforce plan was a good first step on the way to properly staff maternity services. So question 6, we know the government will be looking at a refresh in the summer. And so will the Minister use that time and give an undertaking today that the women's health in both primary care and secondary care will be a priority? And could the Minister update the House on the DHSC commissioned obstetrics workforce planning tool, which it commissioned to help maternity units calculate the staffing requirements? When will that be rolled out across the country? Chair, in closing, given time is tight, I've heard it said that a healthy woman means a healthy family, a healthy community, and a healthier world. I think that's hard to dispute. It's now for this House to deliver it.
Finally,